My name is Leanne Meyer, and I am one of the co-creators of Nurses Transforming Healthcare. I'm here today with Kathleen Bartholomew. We've received tons of questions from people about this who are interested in what else is possible for healthcare. So we would actually like to answer some of the questions that we often get and hopefully answer questions that you may have about this program. So Kathleen, my first question is, why transform healthcare?
Well, I think I can share a simple story that illustrates that. A CFO was showing me around his brand new, beautiful 350-bed hospital. At the end of the tour, I asked, wow, I didn't see any industry in this community. Where do people work? And he said, well, we're the major employers here. And so I responded, well, what are you going to do when you keep the community healthy? And he looked at me and said, I don't understand the question. What? You see, because the current system that we have is not built to keep our hospitals empty. It's built to keep them full. We profit. The more surgeries we do, the more money people make. So why do we need to transform healthcare? There's three really main reasons. The first one is we don't have a healthcare system. We have a disease response system that reacts to disease. A healthcare system would be focused on wellness and prevention so that you wouldn't get sick in the first place. It would actually have some goals. The current healthcare system doesn't have a list of goals. So we need to set the goals. What are our objectives here? Because the first objective would be to keep Americans healthy. And on that one, we failed. So our lifespan keeps decreasing year after year. More than almost 50% of the population now suffers from one of the top 5 chronic diseases. A third of our nation is obese, diabetic, and we're going the wrong way. We're not healthy. We're going the wrong way. So, and I think another reason is that because nurses are suffering, all providers are suffering. And I think there's enough in the media for me not to have to document that.
Mm-hmm. We definitely, I think most people want to be healthy. They want to be well. They want to live their lives. They want to be able to work at a job that they love. And for so many of our citizens now, that isn't an option. And they don't really know why. So yes, we need to transform healthcare, and now is an amazing opportunity to be able to do that. So why nurses transforming healthcare?
Well, nurses have never been in the driver's seat before. Nurses have never occupied a place in the current healthcare system where they could actually do what they know how to do. And I'll give you an example. A nurse practitioner called me from Texas, and she was working in a clinic and spent more than the allotted 15 minutes with her patient and was being reprimanded. Well, what she did was her depressed and suicidal patient who came into her was homeless. And she took the time to make a call so that to get him on the list for housing. See, that's addressing the social determinants of health. Nurses are trained to look at the whole picture, to look at the causes of disease, to say, well, where did this come from? Not to give you a pill. You know, we need our physician partners. They're fantastic at diagnosing and treating. And we're fantastic too at looking at what's causing, what are the symptoms causing this illness. So.
Absolutely. And I think we want to make sure people know that in addition to physicians, other people who are responsible for health, we also want those people involved. So dentists, chiropractors, people who are doing collaborative healthcare. We want those people and their input also because it's important. But what we do know is that there are 4.6 million nurses in this country, and we have never utilized the power that we have just with that number.
Well, we can't, Leanne. We can't, because healthcare is a business that profits on disease. When it is a service, nurses have no vested interest. We do not want our patients to be sick so that we can make money. We do not want to give them more and more drugs. We want to get them off of their drugs. It's a totally different approach.
And one of the things with it is nurses are there with the patient 24/7, 365 days a year. You don't get to walk away from the tears, from the anguish, the family not knowing what to do or how to do it. So our focus is on the patient and how do we return them to a level of health. Whereas I think the levels above us have a tendency to be focused on the incentive of financial return. And as long as that is the case, then the health outcome is way less important. Nurses still have that health outcome as a primary in their care of patients. So what is the adapted public utility model? Can you explain it?
Yes, I was so thrilled when I discovered it because immediately I could see that just like electricity and water were so important, so was health. And just like electricity has an infrastructure and water has a treatment plant, the infrastructure for health is the social determinants of health. So we would address housing and poverty and food insecurity and all of the things that cause illness in the first place to stop the trend of disease in America. Donna Bedian said structure dictates process, which dictates outcomes. And our outcomes are poor. We keep changing and changing the processes, but there's no new structure. The radically new structure that we need is, what if healthcare was a service that profited on wellness and prevention? I mean, that's a totally different model. It's apolitical. And just like long ago, when people thought, I have fire insurance for my house, it doesn't matter if you don't have it for your house. And then suddenly their house burnt down and they went, oh, wait a minute, your house is on fire and you don't have insurance. Like, that's the same thing with disease, COVID. We saw that in the pandemic. We see our vulnerability to each other. So that's really important. And I really believe in this model because it's community focused. You work closely with universities. It really pulls the universities in there. Right now, we have a gap of more than 15 years when a researcher discovers something until it actually gets to practice. We need to close that gap.
Exactly. Couldn't agree with you more. So how does it work?
Well, just like I would love to see it on your utility bill. Yeah. Like, I live in a small town where it says water, sewer, and I just like another line on my bill that says health, $100, $120 a month. That's it. And we all pay into the community, and we use that money to identify what is the biggest cause of disease in our community. Because in mine, it might be addiction. In yours, it might be obesity. It might be pollution in another one. Or in one that we're working with right now, it's asthma and vaping. You know, it all depends. Healthcare can never be top down. It can never be a top down driven initiative. It has to be community owned. It has to be local. And so that's why I'm so excited about this model. It's collaborative.
It's collaborative. It starts at the community level and it works its way up. And the other ways is that we would be setting this up with having regions across the country who would be responsible for, probably would be centered around a teaching hospital. And the research that would be done there would be geared toward how do we help improve the health of those people in our region. And everything everyone was doing would be gearing in that direction.
You'd have regional councils, like you said,
yes.
The regional councils that would address everything. And that would be everybody who has a vested interest in keeping this community healthy. We're talking about from paramedics to university to the chambers of commerce. These regional councils would report to the state, and the state would gather the information for the federal level.
And even I think it would be direct communication from the regional council directly to that special federal council. And there would be communication going back and forth so that it could happen faster. And those things that are being researched by those teaching hospitals that learn this is a new way to deal with something that has not worked in the past, for smoking, for obesity, for all of those things we've just talked about. And then we could share those. There would not be a financial incentive to keep the information to yourself. And public health could be the overall organization that would help pass that information from one area to another, and making sure that we see trends that are happening and we can act on them more quickly. We needed this for the pandemic when it came forward. We didn't have it.
We would have had totally different outcomes if we did, because every single, an advisory board recommended that every single American needs to have a relationship with a trusted provider. That's not going to happen. There's a shortage of 85,000 primary care physicians. It's just not profitable enough, so people aren't going into it. Who's going to step into that role? Nurse practitioners.
So who's going to pay for it?
Good question. We all pay for it because we all need skin in the game. I pay for it in my utility bill. The state pays a portion, the federal pays a portion, but you have to understand that this is a fantastic model because it allows us, as we keep in our community, as we keep people healthier, then our costs go down. The costs go down. The costs, I'm not paying for, people are healthier, so I don't have to, where am I going to put that money then? I'm going to put that money in building more schools, paying teachers more money, increasing the number of daycare centers, taking care of the elderly, low-income housing. But who gets to decide that? Your community gets to decide that. Because as a nation, we are only going to be as strong as our communities are healthy. And our communities are only going to be as healthy as the individuals in that community. So we need a totally different structure that does not reward disease, but that rewards and focuses on prevention, that has an infrastructure that addresses the social determinants, that is affordable, and that will change the trajectory of disease and illness in this country.